prevalent in humans. Let's talk about the ligaments and membranes. The outer ligaments that were present we discussed, they were thyroid, cricotracheal, hyoid, and thyroepiglottic. Let's look at the thyroid membrane. It is attached between the thyroid cartilage below and the hyoid bone above. So here in the 3D model, you can see it right here. It is attached between the two bones, and this attachment this attachment allows the larynx to work as a single unit with the hyoid bone. For the lectures we have covered so far, in the muscles of the larynx, we have seen that the muscles that were elevating the hyoid bone, in their function it was written that they are elevators of the larynx. So that's how they are elevators of the larynx, because when any muscle elevates the hyoid bone, it elevates the thyroid cartilage and hence the larynx itself with it. So these are connected with that. There is an opening on the side that allows for the arteries and nerves that are going to the inside of the larynx. We will discuss them with the vascular supply. This is a question that is asked. What are the structures that are piercing the thyroid membrane? That mostly includes the internal laryngeal nerve and superior laryngeal artery and the accompanying vein. We will discuss them as we will be talking about the arteries. And it is forming the lateral wall of the piriform recess. So let us talk about that, the piriform recess. So the picture that I'm going to show now, it's basically the sagittal section of the through the larynx. So here is the epiglottis cut in half. This one. Here is the thyroid cartilage cut in half. On each side, they are covered by membranes. So this is the thyroid membrane that we talked about. The thyroid membrane, it is making the lateral boundary of the piriform fossa. The pharynx, in this particular picture, we are only looking at the laryngopharynx. In the laryngopharynx, there is a space, there is a depression. You can see this depression. If I add a line, let me add a line here, like here. You can see it is very deep. It is a depressed line. You see, it is inside. It is going like this. It is a depression. This line was going inside. So this tip is called piriform fossa. This piriform fossa, if I remove this membrane, let me remove this membrane. This is the mucosa. If I hide this piriform fossa on the medial aspect, it is being covered by this membrane. This is the quadrangular membrane. On the lateral aspect, it is bounded by the thyroid membrane. So thyroid membrane, when talking about this, we said that they are forming the lateral wall of the thyroid membrane. So this is about the thyroid membrane. We talked about the attachments, the lateral wall of the piriform recess, and it is perforated by internal laryngeal nerve and superior laryngeal vessels, arteries and veins. This is about the thyroid cartilage. Its anterior membrane part is called median thyroid ligament. Then there is epiglottis. Epiglottis, two ligaments are important. We have seen them multiple times in the model now. The ligament that is joining the epiglottis to the thyroid cartilage, this is known as thyroepiglottic ligament. And the ligament that is attaching the anterior surface of the thyroid cartilage to the posterior surface of the hyoid bone, that is known as hyoepiglottic ligament. So these are the ligaments. Let me talk about a structure that is vallecula. Let me get back. Let me set up a few things. Give me 1 second. One more. Okay. No. I have to set up one more thing. The 3D model that I'm going to show now, it will be focusing on the posterior aspect of the larynx. So don't be confused by a lot of the things that you'll be seeing. Let's keep our focus. So this is the larynx, the laryngeal inlet. On the side, this whole ring, this is the laryngeal inlet. The epiglottis on the top, the arytenoid cartilages with the corniculate cartilages here, and in between them there is the epiglottic fold running between arytenoid cartilage and epiglottis. On the top, this is the tongue. This is the tongue, mucosa of the tongue you are seeing. This is the posterior one third of the tongue that is shown with a lot of uh, lobulations, and on the top, this will be the anterior two third. This is the junction between them. Here, between the tongue and the this space, this tip, this is called vallecula. This space between the epiglottis behind and the tongue in front. Epiglottis behind and tongue in front. This space is called vallecula. This is a dip that is present between the two. In this particular model, the one thing that is missing here is a fold that is present between the epiglottis behind and the midline of the tongue in front. So it is dividing the vallecula into two spaces on the each side. These are divided by the median glossoepiglottic fold that is not shown here very nicely. That is medial glossoepiglottic fold. So this is about the laryngeal, this is about the ligaments of the larynx, and this was the vallecula that we were seeing, and there is the median glossoepiglottic fold and the lateral glossoepiglottic fold. They make the cavities on the either side of the back of the tongue. Then we are left with intrinsic ligaments. No, extrinsic ligament, the last one. The cricotracheal ligament, it's very simple. It is present between the cricoid cartilage and the trachea below. We usually do cricothyroidotomy between the cricoid cartilage and the thyroid cartilage here in this ligament, but sometimes this is also used, but again, not so much. Let's talk about the quadrangular ligament. This is a tricky concept. I will try to go back to the model and set up a few things. Let us talk about the quadrangular membrane. So this is a section. The thyroid cartilage has been cut, and you are seeing the ligaments. So this ligament, we have to get a few things now like this. This ligament, this one, this is the quadrangular membrane, quadrangular ligament. You check what are the attachments. Interiorly, it is attached all the way to the epiglottis. It is attached to the lateral margin of the epiglottis. Simple. If we look at posteriorly, it is going downwards in the inner aspect of the thyroid cartilage. And here again, I'm going to remind you that here it is making the medial wall of the piriform fossa that we saw earlier, and it is ending here in the free margin. In the lower aspect, it has two attachments: the attachment to the back to the arytenoid cartilage, the attachment to the front to the thyroid cartilage. So between the two, this free lower margin of the quadrangular membrane, this is called vestibular ligament. This is called vestibular ligament, and they make the false vocal cords. So this is the quadrangular membrane, and let us see right here in this pictures on the Gray's atlas also. So here is the quadrangular membrane shown attached. Let's just focus on this picture first. It is a fibroelastic membrane. It is attached anteriorly to the whole of the epiglottis. Posteriorly, it is attached to the arytenoid cartilage, and lower end is attached to the arytenoid cartilage here and the thyroid cartilage here. and in between them, this free hanging margin, this is known as vestibular fold, the false vocal cords. So when you're looking at the atlas, let me remove myself. When you're looking at the atlas, you will have to see a lot of pictures in different views to get an idea. Here, the anterior attachments are indicated, but the inferior margins are very clearly shown, the vestibular fold. Here, this anterior attachment across the epiglottis, anterior attachment across the epiglottis is shown. A gap is cut to show through it. Here you are seeing the lower attachment posteriorly to the arytenoid cartilage, anteriorly to thyroid cartilage. This free hanging margin, this is the vestibular ligament. And here it is shown with the mucous membranes. So this is the quadrangular ligament. So this is all the things that are written. Fibroelastic extent we have discussed. Anteriorly lower half of the epiglottis, posterior borderly arytenoid cartilage, lower border is the vestibular ligament false vocal cords, and it is defining the laryngeal inlet. This line is the laryngeal inlet. Anteriorly, the epiglottis on the aspect, the mucosa covering the quadrangular membrane that is known as airy epiglottic fold between the airy retinoid epiglottis, airy epiglottic fold, and in between them, then the tip of the arytenoids, including both of the cuneiform and corniculate tubercles, and then there is a mucosa that is joining both of the arytenoids, that is interarytenoid notch. This is the laryngeal inlet. This is the laryngeal inlet, and this is how you can see it from the top. When you see from the laryngoscope from the top, you can see the quadrangular membrane going from the outside to inside as it moves down. So this is how you will see the quadrangular membrane. So this is the quadrangular membrane, and just a quick review on the 3D model again. This is the quadrangular membrane. Between attachment is anteriorly the epiglottis, posteriorly to the arytenoid cartilages, and lower end is attached anteriorly to the thyroid cartilage and posteriorly to the arytenoid cartilage, giving rise to the floor free margin that is known as vestibular ligament. It is housing the corniculate cartilage and the cuneiform cartilages, and it is making the laryngeal inlet. So it is making a part of the laryngeal inlet that is right here. So this will be the laryngeal inlet. Anteriorly it will be made up of the arytenoid, epiglottis, then quadrangular membrane, then arytenoid, and then the part joining between them. And it is forming the lateral wall of the piriform fossa. It is making the lateral wall of the piriform fossa, as can be seen right here. So this part that is between the two, it is between the quadrangular membrane and the thyroid membrane above, and quadrangular membrane and the thyroid cartilage below. This is the piriform fossa. The food actually slides across here. The food does not come on the top of the larynx here. This does not happen. The food slides from each of the sides of the larynx. The food comes either side of the larynx through the piriform fossa back into the esophagus. And this is where the food gets stuck. The things get stuck. Then there is cricothyroid ligament. Going back. Cricothyroid ligament. As the name indicates, it should be very simple, that it is attached to the cricoid ligament and it is attached to the thyroid bone ligament. It is attached below to the cricoid cartilage and above to the thyroid. As the name indicates, it should be very simple, and it is for the part that is near the midline. This particular part, it's called median. This particular part is called median. When there is an N in the end, it means in the midline. Cricothyroid ligament. It's very simple, attached to the cricoid in the midline in front, attached to the thyroid cartilage above. The one that gives you a tough time is this one. It is named as the cricothyroid ligament. It is attached to the cricoid ligament cartilage below, but it does not get attached to the thyroid cartilage above. It does not. If you look at it, oops. Okay. If you look at it, from the aspect you see, it is going up inside the thyroid cartilage. This is the margin of the thyroid cartilage. It is not attaching to it. It is going from the like this. It is going from the inner aspect up inside. Let us look from this view. So see, from here we can see how it is going up inside the thyroid cartilage without actually attaching to it. It is turning inside. It is turning inside, going in the inner aspect of the thyroid cartilage and going up. It is going up. Just like we talked about the inferior margin of the quadrangular membrane, here is the similar situation. The upper end of this ligament, anteriorly it is attached to the thyroid cartilage, the midline, the median angle, and posteriorly it is attached to the arytenoid cartilage in the anterior process that was known as vocal process. And you may have guessed it by now, the upper free margin of the cartilage, upper free margin of this membrane that is running between the thyroid cartilage anteriorly and the anterior muscular process, anterior vocal process of the arytenoid cartilage, this is the vocal ligament. This is the vocal cord. This is what is producing my sound right now. This is vocal ligament. So that is why the part of the cricoid cartilage, the part of the thyrocricoid ligament, the part of the thyrocricoid membrane that is lateral, it is actually running from the cricoid cartilage below to the vocal cords above. So it is known as cricovocal membrane. So the lateral cricothyroid, it's better known as cricovocal membrane. It is running between the cricoid cartilage here and the vocal ligaments right here. So it is cricovocal membrane. So it has two attachments. They are seen. We are here back to this part. So the anterior part, it's running from the cricoid to thyroid, the one we saw here, median, or the median cricothyroid part, and the lateral part, it's going cricoid deep to the thyroid, the vocal cord. So it is known as cricovocal ligament. So it is shown going like this inside the thyroid cartilage. It is shown here. It is attached to the cricoid cartilage and goes up. You see, this is the thyroid cartilage. It is going inside it and it is going to the free margin. This free margin is the vocal ligament. You see, it is going up to the free margin that is running between the vocal process of the arytenoid cartilage to the posterior aspect of the median angle of the thyroid cartilage. So this free margin is vocal cord and attached to the midway between the angle between the back of the angle of thyroid gland and its back, it is into vocal process of arytenoid cartilage. So this is about the vocal ligament, cricothyroid membrane. It is going up like this, like a cone, like a tent. So this is also very elastic because vocal cord continuously have to flap and they have to come back to the normal location. This is mostly in elastic fibers. It contains a lot of it. So this membrane is also known as conus elasticus. This is all